Now in Calgary, Alberta Premier Danielle Smith and Provincial Health Minister Adriana LaGrange are speaking. Let's listen.
Okay with the status quo. Some, either because of ideology or to protect their interests, accept the current results. I do not. I want to provide some more context to this. To deal with surgical backlogs, Alberta Health Services followed the strategic direction provided by previous governments, signed contracts with charter surgical facilities to help alleviate pressure on our health system and increase capacity. And because it has worked, we tried to expand these centres through new competitive bid processes. In terms of the latest RFP process for new facilities, the former CEO of Alberta Health Services made some very troubling allegations. And those allegations are serious and they are being investigated. We have asked the Auditor General to expedite his review so that we can have answers as soon as possible. I also want to make clear that AHS and AHS only was in charge of conducting procurement for these surgical facility contracts. And although they were awarded through an RFP process, those contracts have not yet been finalized, as I understand it. They will not be finalized until the organizations involved have been cleared of any wrongdoing. In terms of the review by the Auditor General, I have directed all government departments to provide the Auditor General with any information related to this matter. Our government will support the AG's office in any way it can to expedite his investigation, and I'm confident that he'll get to the bottom of the allegations. I also have our newly appointed Acting Deputy Minister of Executive Council, Chris McPherson, working to retain a credible independent third party with a strong legal background capable of investigating this matter independently of government so that we can understand exactly what occurred with regards to the procurement processes in question. Whether there was any wrongdoing or improper interference with the procurement process, and why, despite months of requests, AHS never brought any substantive evidence or documentation related to this matter to the minister or to our government. At the same time, we must continue our work on the healthcare system refocusing. We simply will not allow Albertans to continue to wait too long for important surgeries or other procedures. Our cabinet today has made the decision to assign Darren Headley as the Acting Deputy Minister of Health. Andre Tremblay will continue as the Interim CEO and Official Administrator of Alberta Health Services so that they can continue working with Minister Adriana LaGrange on the important work of healthcare refocusing. To that end, we will be setting up a legal conflicts wall within Alberta Health Services and Alberta Health so that Minister LaGrange, the interim AHS CEO and official administrator Andre Tremblay, and the acting Deputy Minister of Health, Darren Headley, can all continue with the critical work of transforming AHS into an effective provider of healthcare services under the oversight of the new Alberta Acute Care Agency. The legal conflicts wall will ensure the complete independence of these investigations without the involvement of the individuals named in the former CEO's statement of claim. I also want to reiterate a point I made last week. I was not involved in these procurement decisions. I had nothing to do with the process decisions or the implementation. My actions were straightforward. The government made a policy decision to expand surgical facilities to tackle the critical issues of wait times. When there were delays in implementing those policy decisions by AHS, the minister made inquiries into the reasons for those delays, just as I would expect any minister to do whenever there are delays with the implementation of any government policy or project. The minister has reported that she asked the former AHS CEO on a number of occasions for many months for information or reports on the issues that are now the subject of her statement of claim, with little or no response, and that's not good enough. The former CEO knew that procurement was about to move into the new procurement secretariat. If there was evidence of problems with AHS procurement, I'd like to know why she didn't disclose it to the minister. We will get to the bottom of what happened here, and if there's any wrongdoing, we will fix it immediately. If mistakes were made, they will be corrected. At the same time, I want to reassure Albertans of our resolve. We will not allow anyone in Alberta Health Services Management or the NDP to frustrate the progress of improving our health system. Let me be clear. From the onset of our health plan to refocus healthcare, AHS leadership has always shown us resistance, and it is clear that they would rather keep all surgeries in hospitals only operated by Alberta Health Services, which would have resulted in 62,000 fewer surgeries for Albertans last year. That means 62,000 family members, moms and dads and neighbors would not have received their hip or their knee or other surgeries that they needed. We will not be intimidated by the resistance of Alberta Health Services management and others who want to protect the status quo. This is about better outcomes for Albertans, and nothing will stop us from continuing our important work. This is why we will continue to utilize charter surgical facilities and any other service provider who will help us get the best outcomes for Albertans. And now I'd like to turn things over to Minister LaGrange.
Thank you, Premier. Last week, the former CEO of AHS filed a statement of claim. Upon review, the allegations
we've been listening
and
to Alberta's
claims
Premier Danielle Smith speaking on allegations by former Alberta Health Services CEO saying her government will support the Auditor General's office as part of the investigation in regards to procurement process in question, she says. This is the first time Smith and Health Minister Adriana LaGrange have spoken publicly since a lawsuit was filed last week. None of the claims have been proven in court.